Hey guys, welcome to part 2 in this mini video series all about the Achilles tendon. If you've not yet watched part 1, where we talk about the anatomy, the function and some of the common causes of pain and injury to the Achilles tendon, make sure you go back and watch it. And if you've not yet subscribed to the channel, then please do. It's great for me, it helps support the channel, and it also makes sure that you don't miss future videos. Now in this one, we're going to start looking at some strategies to actually manage the symptoms of your Achilles pain, Achilles tendinopathy, and also to some extent Achilles strains and tears. Right, let's get on with the video. Okay, so before we start, I just want to make clear that the strategies I'm sharing in this video are going to be more suited towards someone who has ongoing Achilles tendon pain. If you're someone who has had some kind of trauma injury, if you have actually torn or strained the fibers of the tendon or had a complete rupture of the Achilles tendon, then the chances are, if it was a serious one, you've already been to A&E and you've already got a management strategy. Follow their advice rather than the advice you get from a YouTube video. And if it's someone who's just had a really mild strain or a mild tear of the Achilles tendon, then the chances are, after a little bit of resting, a week down the line, you'll probably find the symptoms are mostly gone and you're almost back to full activity anyway. These management strategies are really going to benefit people who are dealing with longer term pain issues, such as sort of tendinitis, tendinopathies, those kind of things. It's also important to make you aware that when it comes to the treatment of the Achilles tendon particularly, everyone seems to react differently. So you may find some of the stuff I share with you in this video works really well, some of it doesn't work at all. That's okay. There is no right or wrong approach to this kind of stuff. As long as we're not doing something that's going to cause more damage, then there's nothing wrong with trying a mix of different strategies and finding the one that suits you. So what I'm going to share with you is a series of different approaches which you can give them all a go and just see which one actually works for you and stick with it. Okay, so the first and most obvious thing that we need to talk about is deloading the tissue. In other words, resting. As I said in the previous video, if you're dealing with an Achilles tendinopathy, then it is the result of overuse. You're asking the tissues to handle more than they are used to handling. Now, the best way to counteract that is to actually take some time off. I know that's not what you want to hear, particularly if you're training for a big running event, for example, or if you're someone who spends a lot of time on your feet at work, but unfortunately it's the best way to start managing the symptoms and to start reducing that irritation on the tendon. So if you are a runner, take some time out. It's better to do it now while you're still at this stage rather than waiting and trying to train through it and causing more damage further down the line. If you're someone who spends all day on your feet at work, then talk to the management about maybe having a bit more rest throughout the day or potentially changing the job roles or something, or even actually just taking a bit of initiative yourself and actually spending a bit of time sat down rather than always putting your weight through your feet. Trust me, your Achilles tendon will thank you for this, and the symptoms should start to ease off fairly quickly if you do take a bit of rest time. So a question I get a lot is, should I ice it? Now, what we tend to find with inflammation and irritation type issues like tendinopathies and tendinitis is that actually icing can be a good management strategy to help with pain relief. However, it's not something you should be looking at doing long term because actually it reduces the blood flow to the area, so it can actually slow down the healing and repair process. So in the early stages, when the pain is really sore and you don't want to do anything with it, then yes, use a bit of ice just to help desensitize the area. So grab a bag of peas from the freezer, wrap it in a tea towel and just stick it on that Achilles tendon. Try to avoid going longer than about 10-20 minutes absolute max. You want to try and avoid actually causing any long-term reduction in blood flow, but it's just going to help reduce the sensitivity of the area and give you a little bit of management from your symptoms. I'd recommend you only do this for a few days while the pain is really, really bad, and then when the symptoms have started to ease down, stop. And actually long term, as part of your rehab, you may find doing the opposite and actually applying a little bit of heat to the area when the pain has reduced a bit helps increase the blood flow and could ultimately help to speed up the recovery and healing process. Okay, so should you be stretching and trying to massage the area out? Now this is a little bit of a controversial one. If you have a strain, if you've torn the fibres, if it was some kind of trauma injury, then I would actually avoid doing too much stretching or any stretching at all, because actually if you think about it, if the fibres are already torn and you're then trying to lengthen them further, there's a very high risk of actually tearing the fibres more or re-tearing it if it started to knit back together. So if you're dealing with a strain or a tear of the tendon, I would say avoid stretching. However, if you're dealing with an overuse injury, an irritation, a tendinopathy type thing, and more of an ongoing pain issue, then you may find a bit of gentle stretching offers some relief. So what I'd recommend is actually do it yourself rather than putting all your body weight through it. Just use your hand so you can create a little bit of a mild stretch, like so. So bring the foot up like so, and then just give it a pull like this. So you're lengthening out the calf muscles and ultimately lengthening out the Achilles tendon. So just pull on the foot like this. You don't want to be applying a massive stretch. You can lift the toes up a little bit as well if you want. And you may find that just doing a gentle stretch like that just helps offer a little bit of relief and reduces some of that irritation. If the pain is really, really quite bad at the moment, or if you've got a huge amount of swelling in the area, then try not to go too crazy on the stretching, because again, it could further irritate the tissues. Now, the other thing you may want to do is a little bit of self-manipulation, a little bit of self-massage. Now again, I would avoid this if the area is really swollen and really angry looking, because actually you could further irritate it. But if you've got beyond the point where things are really quite bad and you've been icing it, you've been resting it, and the pain has reduced a bit, then actually a bit of self-massage may help. So all you want to do initially is just get a couple of fingers, just grab the Achilles tendon, rest the left foot, so keep the foot nice and neutral so that everything's nice and soft, and just wiggle it around a little bit. Hopefully you can see what I'm doing there. So just wiggling it around from left to right like that. So you're just applying a little bit more stretch and just mobilizing the tissues like so. Okay, and you may find that actually just doing that feels quite nice and gives you a little bit of relief. And then what you can actually then do is actually just do a bit of gentle massage in the area. So start closer to the heel. I'd say start behind the Achilles tendon initially on this area here. We're working more into the fat pad, and just massage up. Start lightly and just slowly increase the pressure. Use a little bit of oil or lotion if you've got hairy legs like I have, to save pulling through the legs, or to try and reduce any friction on the skin. Okay, and then you can then work through the actual Achilles tendon itself, so actually feel for that band of tissue and just massage in to the actual tendon itself, like so. Okay, you can also go side to side, so coming from that angle and running over the fibres this way. Okay, and then again go from the other side, so again working up into that fat pad and then onto the tendon itself. As I say, you don't want to do anything that's going to further aggravate it. So if you start doing that and instantly it feels uncomfortable or not very nice, then stop. The whole purpose of this is it's not going to fix anything, it's not really solving any issues, it's just to help manage the symptoms. So you may find that just a little bit of gentle massage helps slightly desensitize the area, helps increase a little bit of feel-good hormone and that kind of stuff, which may actually help manage the symptoms and just help relieve the pain. And there's no set method for this in terms of how long you should do it or how often you should do it, so just use a little bit of intuition and just do what feels right for you. As I said at the start of this video, a lot of this is a bit of experimentation to find out the right approach for your personal Achilles tendinopathy. So another thing that may offer some relief is kinesiology tape. Now, this can be a little bit hit and miss, if I'm honest. Some people find it really helps, some people find it makes no difference whatsoever. Me personally, if ever I've got a little bit of a niggle, I like to use tape. It definitely seems to make a difference for me, and certainly does for some of my clients. Is that a placebo effect, or is it making some real changes? I don't know. There's not a huge amount of evidence either way. To be honest, I don't really care. If I feel like it's making a difference to me, or if I find it's helping with my clients manage their pain, then I'm going to use it. The great thing about this is it's not going to do any damage, so there's absolutely no harm whatsoever in trying. Some of the other methods that I'll talk about in a minute may cause some damage, so actually you need to be a bit more cautious with it. But this stuff, it's not going to do any harm, it's pretty inexpensive, and it's simple to use. So what I'm going to do is show you a really quick taping technique just to help with the Achilles tendon and the calf. Okay, so we're going to start with two pieces. One piece which is long enough to go from underneath the heel up the back of the leg, and then one piece that's shorter that's just going across there. There's absolutely no difference in the different colours. I've just used two different colours just so you can see what the application looks like. So we're going to start with the longer bit. What we're going to do is tear off some of the backing tape like so. Okay, we're then going to stick it to the bottom of the foot with no stretch on it whatsoever. Okay, give it a nice little rub to make sure it's on there properly. Okay, and then when you've done that, pull the tape so that the packing paper comes away, and just stick it round onto the bottom of the heel like so. And then we're going to apply a little bit of a stretch, so just pull your toes up towards your shin. Do this in a way that doesn't cause any pain. So if you find that the stretch is causing pain, just relax it off a little bit. But just stretch it as far as you can comfortably go, and then you're just going to press it round the back of the heel, up the back of the leg, hold that stretch with the foot, and then when you get to the top, when you've got an inch or so left, just relax it off so there's no stretch, and just stick it down like so. Okay, squeeze it around the tendon like that, and then just give it a little bit of a rub with the paper just to help it stick down. Okay, so the first bit looks like that, really easy to do. Next bit, we're actually going to go around this way, so we're going horizontally, transversely, rather than vertically like that. So what we're going to do with this one is we're going to tear this one in the middle like this, fold the backing paper back, so we just hold it at the end to make sure we're not touching the sticky part like that. Okay, then I'm going to apply a little bit more of a stretch with the tape this time. Don't worry about trying to stretch the foot or the calf. And then we're going to apply that around the Achilles tendon, around the spot which is particularly painful. Okay, and then just stick the ends down again without any stretch, like so, on both sides. And then just give it a rub with your backing paper to activate the glue and make sure it sticks down. Okay, make sure you've cleaned the area off properly before you do this, and if like me you've got particularly hairy legs, then you may want to shave the area off a little bit, or particularly when you're taking it off, make sure you do it with some hot water, otherwise it can be a bit sore when you pull it. There's no reason you can't keep it on until it starts to come off itself. Make sure you've rounded the edges of the tape using a good pair of scissors before you use it, and that'll just help it stay on for longer because you won't catch the corners and won't fray the tape or start pulling it off. Now you may be offered some other potential ways of managing the pain and some potential treatment options. Some of these can be a bit invasive and they can certainly be expensive, so I would be really cautious before you start going down that route. One that's quite often thrown around is shockwave therapy, which can be incredibly expensive. You can be looking at £100 a session, and you could be told that you need sort of 6, 8, 12 sessions before it starts making any difference. There's not a huge amount of evidence that it works. Some people find they get really, really good results with it, but because of the price of it, my personal opinion is to try other stuff first, particularly some of the rehab exercises we're going to show you in the next video, and use it as a last resort. Don't dive into that as your first choice. Another one that's quite often used for tendon type issues is steroid injections or cortisol injections. Personally, I would avoid these. You may find that other people tell you differently, and I'm certainly not going to start shooting down other people's methods or rationale. But what I've found is that actually it can offer some short-term relief, but actually what they're injecting into the tendon long-term could cause some actual damage, which may then cause more problems further down the line. So yes, you may get some really quick short-term relief, but actually you've got to weigh up the risk factors on this. Is that relief worth it if it's potentially going to cause more issues further down the line? With tendons, they can also go in and do some surgery. So they can do a debriding surgery, which actually involves cleaning the area up, taking away any frayed bits of tendon. Again, see it as a last resort option. So explore the rehabilitation exercises and stuff first before you start thinking about invasive techniques such as surgery. Okay. Other things that you may need to consider is obviously just some typical pain management. So using a little bit of pain relief, some paracetamol, a little bit of ibuprofen if you're okay with it. Again, make sure you read the labels and seek medical advice before you start using actual medication. But stuff like that can just help manage the symptoms, just to give you a bit of relief so you can get through your day-to-day life. Okay, so there we have it. That is some management strategies to help with the symptoms of your Achilles pain, your Achilles tendinopathy. Now, the next video is the big one. Okay, when it comes to Achilles tendinopathy, Achilles injuries, the rehab exercises is the important bit. In fact, what I've shown you today is going to potentially offer you some relief, but it's not until you start actually doing the rehab work that you're going to make any long-term changes and start actually properly recovering from this pain or this tendinopathy. Okay, so as I said at the start of this one, experiment a little bit with the stuff I've showed you today, find out what works for you. The most important thing is going to be resting it and getting yourself ready to be able to start handling the rehab exercises that I'll show you in the next video. Thank you very much for watching, guys. I hope this one helps. Make sure you give it a like, leave a comment if you've got any questions, and I'll see you in the next video and we'll start doing some actual rehab work.